Let's take a moment to talk about diarrhea. According to the Mayo Clinic, diarrhea is the cause of over 215,000 infant and child deaths. This is in part due to the prevalence of rotavirus infection. Today, you might not even think it is possible to die because of diarrhea, but that is most likely because most, if not all of you, have been vaccinated. Before the advent of vaccines, most children in the United States had been infected with rotavirus by age 5. In today's society, we have truly seen the detriments of not vaccinating. For example, recent measles outbreaks. While we have recently been reminded of the detriments of not vaccinating in the recent news, we have also seen their importance at helping control and eradicate infectious diseases. Today, I will impress the systematic need for the mandatory vaccination of all citizens. At the age of 24, I have had countless vaccines, boosters, and even choose to get the flu shot annually. Therefore, I am resistant to polio, smallpox, rotavirus, measles, and many more infectious diseases because of my previous health vaccine history. Today, I will teach you the undeniable truth regarding the importance of vaccination and show the crisis that would emerge if we do not mandate vaccines. First, let's take a moment and explore the problem of our vaccination crisis in the United States. Why are people contracting vaccine-preventable diseases? Overall, the problem is that people are still dying from diseases that we have the power to eradicate with vaccines. This problem is driven by citizens electively not vaccinating themselves and their families. We are already seeing the impact of this. Even though measles was declared eliminated in the U.S. in 2000, 349 cases have been confirmed in 2018. This is according to Inside the U.S. Community Battling a Measles Outbreak and a Wave of Anti-Vax Sentiment. Now I want you to imagine holding your baby for the first time. New mom Moss was so excited for her baby girl Alba, but soon after birth she contracted measles. It has been absolutely horrific, Moss continued. Imagine your baby having to fight off a killer virus with little to no immunity. This is the reality for over 1.5 million children globally that die each year from vaccine-preventable diseases. In the United States, this is not an issue of access, but largely because of the growth of the anti-vaccination sentiment. Overall, major studies from the Journal of Family Medicine and Primary Care, along with the CDC, concluded that lack of knowledge, social media coverage of vaccines, and systematic unawareness were the top factors for non-vaccinators, and these were their main reasons. In addition, we were able to see these mixed signals in our social media, in the news, and also by large groups of negligent mothers. All of this paints an unfortunate and frustrating picture. Thanks to recently relative advances in our understanding of infectious diseases, we have developed vaccines as a tool by which we should not have to worry about our children contracting these devastating infections. Yet, this is the reality we are still living in. We have discussed the devastating consequences surrounding the decision to not vaccinate, as well as the misinformed rhetoric driving this systematic problem. Now we will look at a solution along with a policy that will benefit those in the United States. Vaccines work, and they help us build immunity against viruses and bacteria, so we never have to be infected in the first place. It starts in the immune system in essence. Vaccines exploit this whole immune system response, which triggers your body to create an arsenal of tools and memory against a disease. This is a summarization of vaccines. Vaccines Part 1. Vaccination has been a safe and invaluable tool for literally hundreds of years, and work towards eradication of infectious diseases has been a triumph for public health. Scientist John Enders, for his outstanding achievements with poliovirus, was awarded together with T.H. Weller and F.C. Robbins the Nobel Prize for Sociology and Medicine in 1954. Some may say this was one of the greatest achievements for public health services to man, and similar work resulted in the eradication of smallpox in the 1980s. There are counter-arguments to vaccination. Some include civil rights movements, accessibility issues, people who cannot get vaccinated due to health issues or religious beliefs. There are countless arguments that have been made to not vaccinate. But beyond these parameters, where kids fall through the cracks on vaccinations, entire generations of children can miss out on vaccinations. This leaves generations susceptible to vaccine-preventable diseases. There are many policies that demonstrate the efforts put forth by healthcare providers and advocates to protect the public from vaccine-preventable disease. But how do we build upon the basic policies in place? We educate the public. We limit non-medical vaccine exemptions and provide access by lowering or eliminating costs of immunizations through healthcare plans. In doing so, we increase the herd immunity and we save lives. For this policy to be effective, vaccinations would be attached to your Social Security numbers or identification cards. This will be a way to undeniably hold citizens accountable for the problems we face with anti-vaccinators, media, and so much more. For practicality on this issue, and to create a strong policy, I looked to Doctors Without Borders to see what their parameters for vaccines were. To make this policy practical is to have emergency response during outbreak, continuing to produce new vaccines, introducing new vaccines to impoverished populations, to have outbreak prevention for all ages, boosting basic prevention vaccines in pediatrics and emergency programs, bringing new tools and approaches to the field, and finally, advocacy. So today, as I have discussed, we can clearly see how immunizations can benefit ourselves and others. With education and scientific knowledge at the forefront of change, it is important for you yourself to be empowered. As we face a world of unknowns, especially in today's society, it is imperative to protect one another. So what do you say? Is it worth a shot?